Managing acute appendicitis. Let's talk about what happens when your appendix acts up. Hey everyone, welcome back to the channel. Today we're diving into a super important topic, acute appendicitis. It's one of those medical emergencies that can really sneak up on you. So let's break down what it is, how it's diagnosed, and most importantly, how it's treated. Ready? Let's get into it. Spotting the signs. First off, how do you even know if you, or someone you know, might have appendicitis? Classic symptoms include pain that starts around your belly button and then moves down to the lower right side of your abdomen. You might also feel nauseous, lose your appetite, or even throw up. And if you press on that spot and it hurts or feels tender, yep, that's another red flag. But here's the twist. Not everyone reads from the same script. Kids, pregnant people, or older adults can show slightly different signs. So doctors have to keep an open mind. Time for some tests. So, you're at the doctor's office. What next? They'll probably order some blood tests to check for signs of infection, like a high white blood cell count or elevated CRP. Sometimes they'll want to rule out other issues, so a urine test might be on the list. Imaging is where it gets interesting. Ultrasounds are often used for kids and during pregnancy, while adults might get a CT scan because it's super accurate. And if you're pregnant and ultrasound isn't clear, MRI is the way to go, getting you stable before any big moves. The first step is to make sure you're stable. That usually means nothing by mouth. So, no food or drink, IV fluids to keep you hydrated, and pain meds to help with the discomfort. If doctors suspect the appendix has burst or things are complicated, they'll start you on antibiotics right away. Think combos like ceftriaxone and metronidazole, or something broader like piperacillin tazobactam. Let's talk treatment now. For the main event, treatment. Most people will need surgery, and these days, laparoscopic appendectomy is the gold standard. It's less painful, there's a smaller scar, and you're back on your feet faster. But what if surgery isn't the best option? In certain cases, like if the appendicitis is uncomplicated or the person is high risk for surgery, doctors might try antibiotics alone. Just a heads up, while this can work, there's a 15 to 30% chance the problem could come back. What if things get complicated? If the appendix has burst and there's an abscess, doctors may use a needle to drain the infection and then give you strong antibiotics. After things calm down, you might come back for surgery 6 to 8 weeks later. But if there's a serious infection all through the belly, called generalized peritonitis, it's straight to the operating room for emergency surgery and a good clean out. After surgery and recovery, once the appendix is out, early movement is encouraged. If the appendix was ruptured or gangrenous, you'll stay on antibiotics a bit longer, and your care team will keep an eye out for any complications like wound infection or abscesses. Special groups and key takeaways. Kids and pregnant patients need special attention because things can get complicated quickly. If you're elderly, symptoms may be less obvious and risks are higher, so doctors are extra cautious. So, to wrap up, for most people, surgery is the way to go for uncomplicated appendicitis. If things are complicated, you might need antibiotics, drainage, or even delayed surgery. Non-surgical approaches are out there, but the appendix can act up again down the road. That's it for today's deep dive on acute appendicitis. Remember, when in doubt, seek medical help fast. If you found this episode helpful, don't forget to like, subscribe, and share with someone who might need this info. Catch you next time on the Everything Surgery podcast. Dissect the extraordinary.